Well, good morning, everyone. I'm Emily Parkhurst. I'm the president and publisher of the Puget Sound Business Journal, and welcome to Recover Seattle. Today, we're going to be taking a look at public health and the economy. This is part one of a four-part series that we are presenting in partnership with the Downtown Seattle Association and Schwabe, Williamson and Wyatt. During today's discussion, we're going to hear from some public health experts about what business leaders need to know about reopening and what they recommend when it comes to restarting the economy while keeping people safe. Now, please join me in welcoming my co-MC for today's event, DSA CEO John Scholes. John?
Thanks so much, Emily, and good morning, everybody. Good morning, Emily. Good morning, Graciela. It's a great pleasure to be with you all today virtually. We're real pleased at the Downtown Seattle Association to have the opportunity to partner with the Puget Sound Business Journal and Schwabe, Williamson and Wyatt on a four-part series, as Emily mentioned, focused generally on recovery in Seattle and our region as we look forward, and more specifically on the foundational aspects of recovery, the state of public health and the virus, our economy and the economic outlook, and how we rebuild to a more inclusive economy and community within the Puget Sound region. Our desire in putting this series together is to bring you, civic and business leaders, actionable information that is useful to you in your own decision making and the leadership of your company and your organization. The decisions that we make as individuals, as business leaders, as leaders of nonprofits over the next several months, in many ways will determine the trajectory of our region for decades to come. So we are working to assemble the experts in each of these areas to bring you information that you can use in the decisions that you must make as a business or nonprofit leader. In developing this series, Schwabe, Williamson, and Wyatt has been an incredible thought partner to us. We're really grateful for their support. Here to introduce today's topic and to provide more context on what we hope to cover with you today is Graciela Gomez-Calgary, the CEO of Schwabe, Williamson and Wyatt, and also I want to mention a member of the board of the Downtown Seattle Association. Good morning, Graciela. Thanks again for your partnership. I'll turn it over to you.
Thank you, John. As John noted, my name is Graciela Gomez-Calgary, and I'm the CEO of Schwabe, Williamson and Wyatt. We are an industry-focused law firm with an almost 4-decade commitment to Seattle. I am also a proud member of the board of the Downtown Seattle Association. And I'm delighted to be here, frankly. You know, wow, what an interesting time it is to lead an organization, as I'm sure some of you in this virtual room can attest to. We've been facing some of the same issues as you. When do we reopen our offices? How do we keep our folks safe? How do we open? Do we take temperatures? And what can the buildings do to help us maintain and not spread contagion? Which is why we wanted to bring this series to the Seattle community to discuss pressing issues and recover together. The goal of our panel today is to bring you the latest thinking on from some of the area's leading public health experts and to highlight information that we all will need to plan for the fall and beyond. As a community, we really must continue to lean into each other to fight the virus's spread, no matter how challenging and no matter how long the battle continues. The death of community leader and Congressman John Lewis has weighed on me in this past few weeks and days, and I find his words really spot on during this difficult time. He wrote, "Do not get lost in a sea of despair. Do not become bitter or hostile. Be hopeful and be optimistic." And with that, I thank you for being here today. Emily, take it away.
Thank you so much, Graciela. And I love those words. I mean, the optimism is really important right now. So that was great. Thank you so much for kicking this off. We also want to thank the wonderful people at Urban Renaissance Group who have stepped up to support this series. Urban Renaissance Group is a Seattle-based full-service real estate company focused on investing, building, and managing great buildings. And URG believes in the power of place, which is really a perfect message for today, the power of place. So we want to thank them for supporting this region and all its special places and by helping us produce today's program. Now, we are excited to welcome the amazing panel that we have for today's discussion. Please join me in welcoming Hillary Godwin, the Dean of the University of Washington School of Public Health. Hillary has 15 years of experience as an academic leader, where she has focused on nanotoxicology and lead poisoning and its impact on public health. Before coming to the UW, she spent time at the University of California, Los Angeles, and served as the chair of the chemistry department at Northwestern University. Welcome, Dean Godwin.
Thank you.
Please also welcome Patty Hayes, who's the Director of Public Health for Seattle and King County. The department is the 9th largest local health department in the country and focuses on everything from epidemiology to disease control to jail health services. Patty has 30 years of experience in public health, policy, and advocacy, and has also worked for the Washington State Department of Health. Welcome, Patty.
Thank you.
And she's masked up today, so representing the good fight here. Thanks, Patty. And please join me in welcoming Dr. Joanne Roberts, who's the Chief Value Officer and Senior Vice President for Providence St. Joseph Health. Dr. Roberts is a hospice and palliative care physician who shifted from a 10-year career in newspaper journalism to medicine earlier in her career. Smart move, if you ask me. Before joining Providence, she was the palliative medicine hospitalist at the Everett Clinic, and then posted to Providence Regional Medical Center Everett, where she became the Chief Medical Officer. Dr. Roberts, welcome.
Thank you. I'm humbled. Thank you.
It's great to have you all. John, do you want to kick us off?
Let's dive right in. Great to have all of you with us, Dr. Roberts, Hillary, and Patty. Thank you again for your time today. Patty, we're going to start with you, and I just want to thank you in advance. You've made yourself available to our organization, and I know many others, and been so generous with your time to help the business community and employers really understand the data and where we stand today in combating this virus. You've been very generous, and we appreciate that. And it might be worth mentioning just why you're wearing a mask.
Sure enough, thank you. It's such a real pleasure to be with all of you today. And I'm actually in a public place. After many months, I am down in my dentist's office. She graciously agreed to let me do this from her waiting room where they have no one. It's just me. And so I'm all masked up protecting her staff, and it's great. So it's Dr. Rose Bailey in Olympia. So very happy to be here.
Well, I thought that was worth mentioning because it just is a testament to your dedication of getting this information out to decision makers and business leaders. And so we appreciate you accommodating us, and we appreciate your dentist as well. So I want to just start, Patty, and you all have made so much data available to the public through some great dashboards on your website, a dashboard of daily indicators, and then a separate dashboard of key indicators, so we understand sort of where we sit today with regard to the virus. And I think that's an important place for us to start with our program, is give us an indication from your perspective, and maybe a little bit beyond what the specific data and metrics say. How are you looking at the data? What does it tell us? What's your outlook over the next several weeks for King County?
Great, happy to do so. And I brought a couple of slides to show you all. And again, we have been working very hard to develop dashboards and improve them so that the community and businesses can have the most transparent view. So this is one of our pieces that are on our website. It's the 14-day incident rate by date of test result. We watch the data on a rolling 14-day as well as 7-day rate. But this actually goes back to the beginning of the outbreak, which again, King County was the epicenter when Life Care outbreak happened at the end of February. And you'll see over time that we bent the curve. It went to a great level where we were actually beginning to meet the target that was set. And then we began opening. You'll see the results when we went to the phase 2 opening. and we've had a steady increase in cases since that time. And as you see in this, we almost touched back up to the same rate we were at the end of March. And the last couple of weeks, the data is not necessarily totally complete. These test results, of course, come in. But I just want to say that August 2nd dip there might not be, the data isn't all in for that. But you can see it looks like we're on a slight decline. We have put out a number of measures to try and get folks being compliant with the essential elements for community mitigation, which are physical distancing, wearing masks. It is hand hygiene frequently. It is staying home when you're ill. But these messages are just so necessary and so imperative for the business community to open up. Do you want to go to the next slide? So the next slide I've got for you is I've clipped off the key indicator. That's one of our dashboards, and you'll see at the bottom of it the link to our dashboard website. So you have that, and I encourage you all to go in there. You can look at areas within King County as well as King County overall. But as you'll see in general, we are having a problem with not meeting some of the main metrics, which has to do with the number of cases and the spread. So we are still above the reproductive rate. That's the second one on here. Just a couple of weeks ago, it was upwards to 1.5. And again, that's an indication that how the virus is spreading around the community. So it is still above the metric. We are finding that in phase 2, so many people are out and about that as our case and contact tracing team is trying to hone down as to where the infection is spreading and how it's spreading, we are finding one of the highest levels in household transmission. That's somebody bringing it home, and then the family gets it. Essential workers, of course, are vulnerable. They're out, they're working, they're helping us every day. The community transmission is really clearly happening, and community transmission can run everything from the parks to the backyard barbecues. We had an outbreak up in Whatcom County with a whole bunch of young people who were having a kegger down by the river. Luckily, we haven't had that here, but we had the Greek Row outbreak because they had a modified rush, and we had over 100 cases of younger folks there. The activity, COVID activity right now, or the outbreak, has been centering mostly in folks under the age of 40. But in the last week, we're seeing an uptick in the age of 40 to 50, and that's what we would expect. The younger folks who have a harder time social distancing, this is a challenge for all of us, as Graciela said, but particularly for young people who are oftentimes not as severely impacted. They have been getting out and about, and this is what happened in Florida, where it started in the younger people and then really moved into a place where the hospitals were being overrun by very ill people. Luckily, our hospitals seem to be stable right now, but we watch that metric very closely. One thing I want to note is our BIPOC communities continue to experience a disproportionate impact of COVID-19. And again, that should not be a surprise to anyone. Those communities have suffered over years and years and years of disproportionate treatment. It's a sign of our country's problem with institutional and structural racism. We've seen health conditions that BIPOC communities suffer from in a higher rate, so they are more vulnerable. They're also a higher level of our essential workers, so they're being exposed more. So we're working with community-based organizations to really help us with messaging. We're translating in lots of languages to help those communities, and working closely, particularly in South Seattle, to increase some strategies, such as the next bullet here, which is a focus on testing. We know that it's very important to have testing out so that not only can someone find out if they have COVID, but then we can find out who they were exposed to, get those people tested and isolated or quarantined. Contact tracing, we have basically 50 folks hired so far. We're on track to have 75 by September. We will be bringing on teams specifically for to help with the schools out, because there's lots of concern when the schools do come in session. And then really concerned about the long-term effects on community well-being and mental health with this. Our lives have totally turned upside down. Lots of folks are very isolated. It's been so tragic when I've talked to families who are not able to visit their family members who are in nursing homes. There is just a real long-term effect that we're going to see. I talked to one young mom, and I'll end with this, whose 3-year-old had an image of COVID being the monster outside of the house. And when she would take her 3-year-old out, he would cover himself up with a blanket because he was so frightened of COVID. So this affects all of us, and we need to really, as you said, we need to come together as a community. I so appreciate the business community engaging with public health. It's been awesome, the conversations we have. So thank you so much, and I'll stop there for the moment.
Thanks, Patty. That was a really great intro, and really helpful to have those statistics to sort of jump into this conversation. So thank you for that. And I think we all feel like that 3-year-old sometimes wanting to put the blanket over our head, for sure. So we'll dive into the mental health question in a little bit. But Hillary, maybe I'll turn it over to you, and then Joanne. As you look around the Puget Sound region, the state, what are you watching most closely right now in terms of metrics? And as you look toward the fall, what concerns you? And maybe just give us kind of an overview of what you're seeing.
Yeah. So the thing that I'm monitoring most carefully is something that Patty alluded to, which is sort of the spread in the disease from predominantly younger people out to older people. That's a trend that we've seen in other parts of the state. So that's what happened in, for instance, Yakima. And it's also what we've seen in other parts of the country, like Florida. And with that spread, we tend to see an increase in hospitalizations and deaths because the incidence of having severe disease is higher for the older population. So that's one that I'm sort of watching closely, is that how quickly is it spreading to other components of the population. And I guess I would just sort of take a step back, though, of like a little word of optimism to echo Graciela, is like, you know, in general, Seattle and the Puget Sound region and Washington State have been doing remarkably well during this. We were, you know, the initial outbreak place. We're incredibly blessed to have amazing public health leadership, both at the local level with Patty and Jeff Duchin, and then also at the state level with John Weisman and Kathy Lofi, and also our elected officials and our business community, who all talk to each other. And so this is part of why you know, we're pretty optimistic as we see that curve looking like it's starting to come down. That, you know, we did it before, we were able to bend the curve down, and we're hoping that working together that we can do the same thing. But it's going to require us all pitching in and, you know, taking those measures that Patty talked about, and really pulling together to make sure that we're taking the actions that we can to keep the levels down. Great.
All right. Well, I like that optimism, Hillary. Thanks for that. Dr. Roberts, how about you? Maybe you can talk a little bit about hospital capacity too, which Patty touched on.
Sure. So I am humbled to be here with two public health experts and to be introduced as a public health expert myself. I'm really not, but I come at it from the health system standpoint. I think what we're watching are the same metrics that Patty and Hillary talked about. We watch the infection rates very, very carefully because we know that today's infections are going to be the hospitalizations 3 or 4 weeks from now, which are going to be the deaths 3 or 4 weeks after that. So we use those numbers to predict our hospital capacity a month from now. So I think the infection rate is worrisome for us. I think Patty's curve was the best illustration of where we are. That said, we serve 9 major markets along the West Coast, and I would say Seattle is probably our highest performing market right now in the infection rates, which is good news and bad news, because if Seattle's the best, you can imagine where some of the other markets are. But I can't thank the business community and the political community in King County and the Puget Sound in really rallying folks around what needs to be done around masking, distancing, staying away from crowds. I think we've done a remarkable job in Washington State, and we should be proud. As far as hospital use, today we have about 45 patients in our 6 hospitals in the Puget Sound area, which is about where we were 3 months ago. We saw that fall, and now we're seeing a rise again. It's not in the intensity we saw. We have more PPE and supplies as well as drugs. We have ICU capacity. What we are seeing, interestingly enough, on the medical side, and this is just the medical side, is we're seeing fewer deaths in the hospital from COVID. Our death rates in the hospital have fallen about 40% since the first 3 months of this pandemic. And we've done a really deep dive and statistical analysis, and we're not sure why. It's not just age, it's not just comorbidities, it's not even race. It is, we've seen a definite fall, and it may be the virus itself, it may be our care is better. We're still trying to figure that out. However, we are seeing an increase in non-COVID deaths in our hospitals. That backlog of patients who put off their heart care, put off their cancer care, we're starting to see the results of that. So our overall death rate is actually up by about 10% over last year. And that's generally non-COVID deaths.
Wow, that's frightening, actually, Dr. Roberts, to hear that, and because that was predicted earlier on that would happen. So it's, I guess it's playing out. Go ahead, John.
In some ways, this leads into the next question, and we all are hopeful and optimistic and eager for a vaccine that's widely available and treatment that's widely available. And I want to ask you, Patty and Hillary, what's your outlook? What's the best case? And then I'll come back with a follow-up question of, if we don't achieve that, do we have to then think about managing this virus and our activities and the restrictions differently, given the comments of Dr. Roberts around the implications that we're starting to see with public health generally? But first, let's start with your sense of the best case when it comes to a vaccine that's not only viable but available.
So happy to start with that. So let me begin by saying that it's amazing to live in a time where we're seeing science in action, live time. So we're learning about this virus every day, and that is going to be a key element with both treatment, what we do in the future, and also a vaccine. So the hopeful news on the vaccine front is that public health has signaled to the system, to local public health, to begin planning. So we hear projections that maybe something will emerge later in the fall. I think, Even I've heard Bill Gates talk about early first quarter, potentially something emerges. But I think the caution for us is when that vaccine emerges, does not mean it's totally available for everybody. We will be going into a very tough time in this country, which is the largest vaccination effort in our history. And we will need to work extremely closely with businesses and the healthcare system to do this, because we will have to prioritize healthcare workers and go from there and get it out in the most vulnerable. So it is going to be a massive planning effort. At Public Health Seattle King County, we have pulled together a team to begin looking at this. It's hard to imagine because we're so still in the response to set aside some staff to do this, but we're on the statewide committee helping to begin the development of what would this level of mass vaccination look like and how would we do that across the state. So I think that's the most hopeful scenario from my perspective. Hillary?
Yeah, I would agree that's the most hopeful perspective. I'll add some of the flip side of sort of the cautionary parts of what we can probably expect. So one is that we have never developed and deployed a vaccine this quickly in our history. And so what we know is that usually initial vaccines that come out aren't as effective as sort of later generation vaccines because they haven't been optimized. And so I think it's reasonable to expect that probably the first couple of vaccines that come out, we would, if we're super lucky, one of them will be really effective, but they're probably not going to be as effective as some of our go-to childhood vaccines that we depend upon, like measles vaccine. So that's going to mean that even once we get it deployed broadly, we're not going to get the same kind of herd immunity that we would want. So that's one cautionary tale. Another cautionary tale is that, you know, we live in an area that has high vaccine resistance. And so, you know, we're going to be fighting an uphill battle there in terms of getting broad uptake of the vaccine. That's part of the challenges that Patty was alluding to. And then we also have the continuing challenge of not knowing how long immunity to COVID will last. So we're starting to get data about how long natural immunity lasts for people who have been infected. And it's looking good in terms of that, at least for a couple months, people are covered, but it would not be surprising if with the vaccines that are developed, if they require multiple rounds of vaccination in order to become or remain effective. So all of those really complicate our ability to get up to a level of herd immunity that would protect people who, for whatever reason, can't get a vaccine or aren't vaccinated, or the vaccine coverage doesn't work. So those are all huge challenges for us, and I think sort of brings us to your next question, which is sort of what's the fallback. I would say realistically, we should be planning for an extended period of time where we're living with circulating COVID. Of course, we are optimistic that we're going to have some better tools in terms of therapeutics and vaccines. But I think realistically for the next couple of years that we're going to have COVID circulating, and we're going to still have concerns about vulnerable components of our population being susceptible to COVID. And that's true regardless of whether we're in the sort of best case scenario with the vaccine or we're not. I think, you know, what I've been signaling to my organization, both at the school level and the university level, is something that I think is relevant to your community as well, which is I really feel like it's time for us to sort of shift from this is an emergency and we're dealing with it at an emergency response level to really thinking about this is the new normal. And so how are we going to live with this for the next couple of years? And how do we change the way that we work and that we interact with our loved ones and that we interact with our community to reflect that new normal and the constraints that are placed on it, but still but aren't sort of feeling like we're perpetually in this holding pattern, that we can move forward a little bit and within those constraints still, get together with other people, socially distanced outside, wearing masks, but at least we're not avoiding, complete contact with other people, which, as Patty said, is socially harmful for people in terms of mental health. So I think it's the same thing's true for business as well, and for organizations, that we need to sort of shift to what's it going to look like for the next year or two, as opposed to just what's it going to look like for the next couple of weeks.
And Hillary, under that scenario, and under assumption that the timeline for a viable and widely available vaccine is longer than any of us would like, how do we then start to account for some of the consequences and impacts that Dr. Roberts spoke to, of folks not getting treatment and preventative care for other healthcare conditions and ailments, of kids not being in school buildings, of the significant unemployment rates and federal benefits burning off, and people being dislocated from their healthcare insurance? How do we start to quantify the public health implications of the decisions we're making around restrictions and social distancing against the impact of the virus itself on people's health and mortality?
Yeah, so first of all, just to acknowledge that public health people are also human beings, and so we do care about all those other factors as well, and we do recognize that economic. No, I know. I just like today, right? I as well say it is like I would say on a daily basis, sort of, we are thinking about, obviously, economic shutdowns are incredibly harmful to people, including people's health. So we are, always sort of thinking like, how are we going to balance those things? In terms of, I forgot what your question was. Getting in my defense of public health mode. I think you were saying, how do we, for instance, manage like getting the hospitals back online and things like that, or people getting healthcare? So Patty's like a great living example of this. This is why you're seeing the healthcare providers saying, encouraging people to get their routine care done. I would say particularly in periods when we have sort of lulls like we did the last couple months, but now like Patty is doing it in a safe way. I'm sure her dentist is also taking all sorts of PPE precautions, because that's part of the sort of, we need to get on with our lives. That's part of where making sure that we don't get too many cases in the healthcare system is really critical, because otherwise they're not going to have the capacity to be able to manage routine care. But Joanna, do you want to talk about that more?
Sure. As far as capacity goes, the hospitals run about 90% capacity on a routine day. So any kind of spike is going to push the capacity issues. I do think, I'll just pass for now. Go ahead.
John, if I could add, I think I was just going to say, in terms of strategies and the weighing of how we begin to open the community and manage the virus is why it's so important to have conversations like this. Let me just start there, because I think that as Hillary said, we're defining this new, we hate to call it normal, but it's the new place where we are right now. And it is developing for those employers that can do telecommuting. They need to do a long-term strategy of that. That's one. There's a lot of businesses that cannot do that, but we need those that can to do that, so that the ones that cannot, then we look at these phased approaches with the governor. How do we reopen things in a safe way? I think the business community has been amazing, stepping up, looking at what are best practices. I started 4 weeks ago, because we regulate restaurants. I thought the best thing I could do right now is amplify restaurants that we find that are doing exemplary job. And so every week we highlight 2, we call them our Star Awards. and it's all over social media. And I have pleasure to do that because I think that business is modeling caring for the community. This is what I meant by community ownership. We have to own these strategies together to figure out how do we open safely? How do we manage back to what feels like we can function as a community?
Patty, this is Joanne. You make a great point, and it reminds me of Hillary's point that this is 2 years, it could be longer, that we're living with this and smoldering along. And I've wondered, if I were a business person today, I often wonder, does my business model need to change? If I'm a retailer, can I survive in a retail environment for 2 years without actually changing my business model? I'm glad I'm not a business person to have to face that I'm a clinician. But I think about, the furniture factory we worked with up in Everett or up in Mukilteo, that they turned on a dime from furniture to masks. Will we see more of that in the business community, where the businesses actually respond to the public health need by directly challenging COVID?
Dr. Roberts,
let me have just a couple seconds, but I would just add this as a business community, as a member of the DSA board, we're committed to trying to keep everyone healthy, and also to try to make sure that our economy remains robust. So we are constantly trying to balance those two things. It gives me great pause to hear you talk about 2 years. I'm just choking on it, frankly, but that's where we are. So we need to work together. If we can help in any way, Seattle, King County, I know that John would echo this. We're here to talk about when and if there is a vaccine, how we help plan on that and distribute that. We'd be happy to continue our good partnership with the public health officials. So sorry, Emily.
No problem. No, I just wanted to ask you, Dr. Roberts, there was a follow-up question on the statistics that you mentioned about the 10% increase in non-COVID related mortality. Can you speak to just that was across Providence hospitals? Is that right?
That is right.
Okay.
And so it's not just King County.
Okay. And how much of that can you tie directly to the delayed treatment? Is it possible to track that in any way?
We're still working on that. We have a group that's studying especially heart disease, because that's often a very acute disease that would show up quickly. And we had anecdotal reports that we were seeing people coming in with later stage heart problems than they would have previously. So we have a health research group in Oregon that's looking at all of our data to really piece that apart. I guess I worry heart disease, strokes, and cancer care are the three that I worry most about in people getting cancer care. The hospitals have generally reopened, and our studies of our own caregivers show that the infection rate of our staff is no higher than the community. And I think that's being pretty well shown across all hospitals. So that's reassuring. But again, if we see a major spike, we'll have to cut back on all that other care that we're trying to catch up with now.
That's a great point. Well, I want to shift the conversation a little bit. As employers are looking to reopen and do so responsibly, or open offices even at a limited capacity, what recommendations do you have for some of them? Patty, I know you're kind of overseeing a business task force support system. What are some of the most important things you think business leaders should be doing or not doing right now?
Well, I really think that we can build off the partnership that we've started, because the business community really has partnered right from the beginning on this, and that has really made a huge difference. One of the things about our region and the success we've had is I think the business community took it seriously and just moved so quickly in the very beginning. So I think some of the key things for businesses to talk about, it gets back to the basic guidance that we have put out. If you are needing to bring people back in the next year into the workplace, then you're going to have to figure out how to have a facial covering requirement and the physical distancing that you need to maintain. What does it mean for the spaces? And when you have groups that have to work on a project together, is that better done by video? How do you do that through a video or other ways of doing that? And if not, then how do you make sure that you're limiting the exposure people have close to each other? One of the things that, as I went down and talking with some of our teams like the Seahawks, they've invested in the technology where everybody that comes on site wears a necklace, and it's that new technology that if you get too close, and so they have people in tiers. The top tier would be the players and the coaches, and then there it goes from there. If a tier 3 person comes within 12 feet of a tier 1 person, a big alarm goes off. So in their case, they're extremely aggressive on the physical distancing piece, not only to each other, because if if 2 players are too close, and again, let's not talk about football right now, but anyway, if it gets too close, it goes off. I think that there's really great technology and models that are going to come out that employers that are interested in piloting something new and working with each other on how it might work. One of the things that the sports teams realized right away is they had to totally revamp how meals occurred. Think about how dramatically we've all changed our meal habits. Well, that's important for employers too. You know, if you're downtown, it's a whole different environment right now. So there's just many pieces to all this on how you have to rethink how you do business. But our business task force stands ready to help over time as we look at different phases, and we work with the governor's office on. I think we've done really well not to get ratcheted back here. He is really worried about a number of areas that I think now felt like they opened too quickly. I think we've been measured. Dr. Duchin has always said, be measured and be careful as you move. And I just applaud the community because I think that's what our elected leadership has done here, and people have responded to it pretty well.
Have you seen any businesses asking employees to get tested before coming back to work? And what are your recommendations, any of you, around that?
I really appreciate that question, because this just came up again in the last week, and we've got to figure out how to get more information out to you. We don't recommend that right now. To do testing in order to come back, really the CDC guidelines should be what we're following. And as Hillary said, we're still learning about this virus and how long the virus hangs around, and and what really is safe. And so we want to make sure that we're following the CDC guidelines. So you will see public health come out again with information on that. And in fact, my ambassador email, which will be coming out again this week, I believe, is really for the business community and for nonprofits. Every other week, I try and get a jazzy new way of talking about all this same stuff we're talking about, freshen it up, or answer questions that you all have had and put a spin on it so you all can deploy it within your sectors. And this is going to be something we're going to be talking about.
And Patty, people can sign up on the King County website. Is that to get your email?
I'm sorry, Emily. My email to get on the ambassador list. Yeah, you can send me an email. It's as simple as that. And my email is Patty with a Y hillary.hayes@kingcounty.gov.
Sorry, Hillary, go ahead.
Yeah, I just wanted to sort of reinforce what Patty was saying about testing, because I think, you know, a month or two ago, all of us were sort of, from an organizational perspective, sort of fantasizing that testing might be the pathway into being able to bring people back on site. And there's sort of two flaws with that. The first one is that it doesn't really give you complete information to do the testing, because someone can have a low viral load or sort of be at the beginning of the infection period and test negative, and then a couple days later or even the next day test positive and be infectious. And so it's, from that perspective, doesn't really give us the actionable information that we had sort of been hoping for. The other one is that we are really running up against nationally the limits of how many our supply chain for reagents and consumables for doing the testing. And that's why you're seeing other parts of the country having these long delays in terms of getting test results back to people. So far, knock on wood, we've been able to not be in that situation here in the Seattle area, because we have amazing groups that have been working on making sure that we have a robust supply chain and access to good levels of testing. But you know, my understanding is that not only have we sort of hit the ceiling in terms of our allotted number of testing reagents per day. So it's not like if companies all decided to do testing, that those tests would take away from other people who are trying to figure out whether or not they have COVID because they have symptoms. So would sort of detract from access to critical information for people. But also we're hitting the same issue across the country as well. So it's be taken away from other regions that also need those tests. Patty, you look like you wanted to clarify something.
No, that's absolutely right. Actually, my dental hygienist just waved at me, so I was just kind of.
So, Hillary, just to follow up on that, actually, we are starting to see squeezes on the healthcare side, on the medical system side, not having enough testing again. I would say that is our biggest pain point right now. We are starting to see hospitals suspend testing for low-risk patients, which we were doing routinely. I'm not sure that we need to do it, but that's what we were practicing. So if we started mass testing right now, it would really create a logjam.
Yeah. So which comes back to the point that Patty made before, which is that, so how do we deal with that as an organization or a leader of an organization? The way that we deal with that is by encouraging everyone who can telecommute effectively to telecommute for this extended period of time, not just for the next couple of weeks, but really to think about that telecommuting being for an extended period of time of a year or two. And that may change the way that you invest in technology and invest in sort of trainings for your folks as you shift from thinking of it as sort of an emergency coverage to this is going to be a long-term sort of status, because we want to reserve those tests and PPE and the sort of capacity of our system to handle people moving around for the people who can't telecommute, the people, essential workers who need to be on site. And hopefully, you know, maybe we'll get to a point where we have enough sort of capacity, we could even open our schools up again. But all those are more important than having non-essential workers come into the office if they can do the work from home.
You mentioned other areas of the country, and there's certainly many that are in much worse situation than we are. I was looking at the numbers in Arizona and Florida this morning. Their positivity rate is in the double digits, while we've been trending low single digits in Seattle. Do you believe that we can continue to have success in managing this virus within our region, even if other areas of the country or other counties across Washington are going in the opposite direction?
I have really a lot of faith in our state and our region. Just the last 5 months has shown me that as we continue to pull together, we just have to continue to talk and support each other as we figure this out and be ready to shift. I think one of the things that's been so tough for people is guidance changes as we learn new things. And people go down a path and they think this is the way we're going. It was like when the governor announced the phases, everybody had this image that we were going to go from one phase to the other to the other. So we have to find a way to support each other as a region. And what encourages me is not only the leadership of the business community meeting regularly with elected officials, it's the real commitment to science. We're such a science-based region. How blessed are we with that? We have the leading folks with everything, including the vaccine development, like right here. And so that gives me hope that we can check, adjust, change, and keep moving, keep trying things, and get through this, no matter how long it takes.
Yeah, I would echo that. I mean, I think, I think that we have a lot of control over our destinies here locally, and agree with everything that Patty said. And I'm confident that we can get our curve back down and get back to a good place and do this reopen a little bit more strategically, and going forward. But I think it is important to keep in mind there are some things that we're going to be impacted by what's going on in the world around us, of course, right? Because it is a global economy, and the supply chain for testing reagents and consumables is just sort of the most recent one that we're sort of seeing. And I think we'll probably see similar things with vaccine availability as well. So we're not an island, and so the extent to which our national system and infrastructure is functioning well is really critical to us being able to continue to move forward productively. But nonetheless, I do totally agree with what Patty said.
Yeah, and I couldn't agree more with what you both just said. And I get to watch 9 major markets that we serve, and I will tell you, Seattle just it stands above every market, and it is about the business community will, it's about the political will, and it's about, as Patty said, we are a scientific community, and folks seem to understand that things do change as we learn more and seem to go along well with that. So I've just been so inspired by the whole Puget Sound community.
We're a compliant brunch.
We are compliant. Although I would say nice. So. As a leader, I have to say, and speaking to other folks who are running different organizations, to the extent that you can help your team and the people who report to you sort of lift up out of this period of intense fluctuation and uncertainty and look towards a longer term trajectory, that of course there'll be still some fluctuations because it's a pandemic and we don't have control over it, but to sort of shift to a longer term vision for this of a year or two, even though I totally get it's depressing. It's depressing for me too. But I think psychologically what I've seen is people responding very well to that, that to a certain extent, people are just very tired, myself included, of feeling like there's not much of a sense of control. And so coming up with a plan that they know this is the plan for X period of time. And, realistically, if, the best case scenario is vaccines not being widely available until, let's say, June of 2021 at the earliest, that's a pretty long period of time that we can plan for and sort of say, like, okay, here's what our work environment's going to look like for sure during that time. That gives people a little bit more comfort in terms of getting on with their daily lives. So that's one that I would say. The other thing that I've found to be incredibly helpful, and this I owe to my incredible boss, Anna-Marie Kause, who's a very values-based leader, but she keeps having us return to sort of what are our values as an organization. And I'm sure all of you guys have done similar kinds of exercises. But coming back to, you know, that as an organization, we care about the people within our organization, and I'm sure all of you do as well, that, you know, thinking about what they're going through with, you know, with school closures, there's so much anxiety from parents of young kids about how they're going to manage their jobs on top of taking care of their kids and managing their kids' daily schedules and their kids' education, which is lagging. And it's just it's a whole new set of challenges that for many of those folks, saying we are going to continue to be extremely flexible about you working from home, and to the extent that it's possible, the hours that you're working and how you're managing your work schedule, I have found to be very something that has helped a lot in terms of mitigating anxiety within my school and my team. So those are sort of my couple of strategies.
That's some great takeaways there. And this was just such a fantastic discussion today. Hillary, Patty, Joanne, thank you so much for sharing your insights and your thoughts today. I also want to thank Urban Renaissance Group for your support of this series, and thank you, John and Graciela, for helping moderate this discussion today.
Thank you, Emily, and I'll turn it back to you, Graciela, to maybe summarize some of the takeaways that you captured from the discussion this morning that you found interesting and that you will take away as the leader of your organization.
Thanks, John. Thank you, panelists. What great information on how to ride this Corona coaster up and down as we change and remain flexible as we settle in to the long haul. I can tell you that at Schwabe, we went from rallying to thriving. And now we're settled into that longer term strategy. We're starting to look at what does the school, the fall, what is that going to look like, especially for parents that are working remotely and that kind of thing. So I echo what Hillary's comments about that. Here are a few takeaways, though. One of the largest increases in cases is due to household transmission, with younger folks bringing it in and older folks getting zapped with it, of course, because they're typically a more vulnerable population. On the medical side, we're seeing fewer deaths. The death rate has fallen significantly, about 40%. And we're seeing an increase in non-COVID deaths because people putting off their care of other conditions. So the message here is go see your doctor if you need to. Make sure you're doing your routine care and doing so more purposefully than perhaps before. Finding a vaccine is not going to be a cure-all for many reasons. One, of course, is that it's going to be a longer-term play. It's not likely to happen immediately, and the vaccines as they come out initially are not as effective as they are over time. Secondly, of course, there's a high vaccine resistance in the state. I hope that all of you listening today will reconsider those positions given the incredible transmissibility of this virus. And, you know, again, it's time for us to shift from an emergency sort of rallying crisis into thinking about this as the new normal. I, as well as you, of course, heard 2 years, which makes me kind of gasp, actually. But that is our new normal. We got to pivot. We got to figure out how our organizations survive, how we remain connected to each other, and how culture within our organizations changes because of this new remote working from home. And finally, there's reason to be optimistic and to remain optimistic. Seattle and the Puget Sound region are doing remarkably well, so please keep it up. And be really intentional about what you're doing and how you're doing it, and please, no keggers. Today's event was recorded, and you will receive a follow-up email with a link. If you missed anything and you want to see that, we'll send that along. The folks, the good folks here at the DSA and the Puget Sound Business Journal will send you further information. The second event in the Seattle Recovers series is Tuesday, August 25th, and will focus on how the Seattle area economy is emerging from the crisis and what business leaders need to know as they plan for 2021 and beyond. Again, thank you all for coming, and thanks again to the panelists and their insights. And please have a safe and wonderful day.
Take care.
Thanks, everyone.
See y'all.